It's been an incredible opportunity, genuinely. I've learned so much more than my expectation.
I've learned so much in the past 7 months that I didn't learn in almost 3 years of my undergraduate program, not to undermine what I learned there, but I learned different skills here.
The experience at the headquarters has been really very enriching, meeting with different experts and working along with them. It's something really great.
The internship program, I think it's very well set up. My supervisor is very supportive. The first thing we talk about when I arrive here is what my objectives are, what are my projects, and what are the expectations. And I think it's very important.
So in May 2018, member states voted to reform the WHO internship program. They voted on a resolution that was passed at the World Health Assembly. And since then, we've been implementing this resolution steadily. So we've been providing in-kind assistance. The interns now have insurance. They receive meal vouchers that they can use in the cafeteria each day. So that allows them to have free lunch, basically. And now we're at the point where just in January, we rolled out the financial support.
The stipend was a huge improvement to the internship program, which helped not just me, but my fellow interns as well to make it here and to live here.
So before coming here, I didn't think actually that I would apply in the headquarters. But because I learned that they are starting to do the stipend this year and the insurance as well, so it gave me an opportunity because if I am not receiving any of that, I will totally not be able to come here on my own. Based on us, the first batch of cohort to have the stipend, it proves already that you can have diversity if the playing field is a bit equal.
I have colleagues from Africa, from Chad. I have colleagues from Asia, Nepal, Bangladesh. So it's really improved the diversity of the program.
Coming from multiple countries, different countries, and now having such a diverse intern population, there's an opportunity for a lot of exchange of ideas, a lot of exchange of experiences between the interns themselves, but then between staff and interns.
Having, like I said, the structured internship program with the intern board and having human resources working with us, listening to our requests, communicating with us on a weekly basis, and just having our voices heard.
The internship itself is very explicit in that this is not just busy work, where you actually get to contribute very meaningfully to the objectives of the WHO, and I felt like all my inputs to projects were welcomed and considered very valuable. And then also has allowed me to connect with people who are further down the line that I can look up to and come back to and ask questions. So I think those connections will really help my career as well.
Overall, we gained so much, especially by coming now, than if we had come, let's say, 5 years ago, when this was not a centralized, structured internship program.
Working at this WHO headquarters in Geneva and experiencing how the decisions are made at a global level, and meeting with a visionary leader like Dr. Tedros, experiencing different function of WHO, responding together to this pandemic, supporting people globally and saving lives. This has been phenomenal.